Well, thank you everybody for joining us. This is a privilege to have Amanda Landsbaum from the APDA chapter. So thank you for talking about Parkinson's disease. And I'm Jason Johnson. I'm the Director of Marketing for St. Elizabeth's Adult Daycare Centers. And we do this every month, the third Thursday of the month. And tonight we're going to talk a little bit about Parkinson's disease and some helpful resources and tips. And I'd like to introduce tonight Amanda.
Well, thank you very much, Jason. Thanks for having me. Appreciate being here. Just a little quick background about myself, and I'll get the presentation started. I'm an occupational therapist, is my background. Been doing it for quite a while, but the last 16 years have been with Parkinson's families. So I've learned a lot from the families, and just love to, share resources and information about Parkinson's. So what I'll do is I'm going to run through the presentation. And then at the end, if you have questions, please do. We'll pause, and any kind of questions you have, I want to encourage you to ask them. So I will share my screen here. Okay. So it's myself that's who's on the slide there, and we also, my other colleague who works very closely with me is Kim Sanders. So if you ever do call our office, us two are the ones that work with the programs at the American Parkinson's Disease Association. So I should say too, and back up, that that's where we are. The APDA is a national organization, but there's different chapters throughout the country, and we are the Missouri chapter. We cover all of Missouri, but then also central and southern Illinois. So we've been around for about 40 years, and just want to make sure people know about us and can take advantage of the resources that we have. So just a little what I'll kind of cover today or this evening. Basically, what is Parkinson's? We'll talk about some statistics and risk factors. Then I'm going to go into the symptoms. And most importantly, we'll talk about treatments and managing well. So how can people really manage well, which is really a key. And then I want to make sure that you know about the resources that we have at the APDA that you can take full advantage of. Okay. So, what is Parkinson's disease? So it is a disorder of the nervous system. It is a neurological, chronic, progressive disease, and it affects people in all different kinds of ways. And when I go over the symptoms, that's clear that it can look different for everyone, for people. But really, it's a lack of the chemical dopamine in the brain. That's been their historical understanding of it. And dopamine really controls smooth, coordinated movement. But also more in the last 10 or so years, they've discovered this alpha-synuclein protein, which actually in folks that have Parkinson's starts to abnormally clump in any area of their nervous system and actually in their body. And the dopamine and the alpha-synuclein are kind of related in that way, but because of this abnormal clumping, that causes a lot of symptoms. So you might have heard with Alzheimer's, that's a different protein, but the Parkinson's is this alpha-synuclein. Unfortunately, right now, diagnosis can be difficult because it's just made by signs and symptoms or the doctor's observation. However, we've had some really great progress in the last number of years. So technically, they can detect that alpha-synuclein in the cerebral spinal fluid with people. However, not everyone wants to have a spinal tap, and so that's not a real common thing to do. But just this past year, a skin biopsy test came out that does detect with pretty good accuracy this alpha-synuclein. So that is a great step forward. So that skin test is available. They're still, I think, working out insurance coverage, but really what the whole goal is to have a blood test and something that's very simple to be able to test with people. And I think we're getting closer and closer. Some Parkinson's statistics. There's about 90,000 new cases in the United States each year. And I'll tell you, when I started kind of doing this, even just 10 years ago, some of the research, it was 60,000 new cases of PD in the US each year. So it has unfortunately grown tremendously, and the projection is now 1.2, some people say 1.3, just in a short 6 years. So it is currently the fastest growing neurological disease. It's the second most common after Alzheimer's, but it is the fastest growing. And so the average age of onset is 60 years old. So, people can have it really ranging anywhere from 40 on up. There's about 10% of cases that people are diagnosed before the age of 50, and that's considered young onset Parkinson's. And men are 50% more likely to have Parkinson's than women. So that's also an area that's being studied. So then the risk factors are, if you're, of course, male, you have a higher risk. Age is the number one risk. So as everyone ages, the risk goes up to have Parkinson's. So that's probably another reason that with the tremendous growth is the aging baby boomers too. But there are these other two pieces that I'll just touch on for a minute: environmental factors and genetics. So genetics, more than 20 genes have been discovered that potentially contribute to Parkinson's risk. So it's not like there's just one gene that if you have that, you have Parkinson's. It's much more complicated than that. But they are discovering more that can, lead to a higher risk of developing Parkinson's with that. Also, environmental factors have been studied, and there is a clear connection with some environmental toxins. So definitely pesticides and also heavy metals and solvents in the environment have been linked to Parkinson's. So farmers have a much higher incidence of Parkinson's. People who work with welding and more metal and breathing in some of that toxic dust. Also, Vietnam vets that were exposed to Agent Orange, that has a direct connection with Parkinson's. So all of those things that are neurotoxins do have some connection with Parkinson's, and that also can relate to why it's growing pretty fast, unfortunately. If someone has had a traumatic brain injury in the past, that actually has been found to increase your risk later on. So, all of these things, they don't think it's just one thing particularly usually with someone. It's usually maybe a combination of things. And this is a map that this was done a few years ago. It was Parkinson's incidence in the United States. And the darker the blue, the higher of the incidence of Parkinson's there is. So you can really see Parkinson's really follows the Rust Belt. It follows farmland, and it follows some major industrial areas too. So I'm going to get into the symptoms. They break the symptoms down into motor and non-motor symptoms. And so the motor symptoms, and the most classic one that people think about, is tremor. And a Parkinson, there's different types of tremor. So you've probably heard of essential tremor. A Parkinson tremor is different than an essential tremor, which is a Parkinson's tremor is one at rest, which means if you're just at rest, then you might have a tremor. But if you go to move or reach for something, grab for something, the tremor goes away. So that's what a classic Parkinson tremor is at rest, when people aren't moving. But really only about 50% of people with Parkinson's have a tremor. So that's why there's a lot of misconceptions about Parkinson's. So just because someone might not have a tremor doesn't mean they may not have Parkinson's. The most common two motor symptoms are the second and third one here, which is bradykinesia and rigidity. So stiffness and slowness. That is across the board. People have to have these two symptoms in order to even be in the umbrella of what they call Parkinsonism. So stiffness and slowness across the board. And then the fourth motor symptom that's can be common is posture instability, so either trouble with balance and or posture. But, you know, we know kind of that motor symptoms, for a long time, that was really all that was really focused on. But again, in the past 10, 15 years, they've really been focusing a lot more on non-motor symptoms and realizing that there are many other symptoms that can be connected with Parkinson's. Now, I'm going to list, this is a long list, and it's not that every person is going to have all of these symptoms. But I do like to cover them so that you know if one of these things or if some of these things you're experiencing, that's something to talk to your neurologist about so that it could be connected with Parkinson's. There's many things that happen that people, you know, say, well, is this Parkinson's or not? And sometimes it's not. It could be something else. So that's why I think it is important to know some of these non-motor symptoms. On the left side, that list, depression and anxiety and apathy. These are all mood, you know, things that affect someone's mood. And it's been said that about 50% of people with Parkinson's will have depression or anxiety at some point. And then apathy also, which is kind of a lack of motivation to do things. And what they've discovered more recently is that Parkinson's not only affects the dopamine, which is the movement neurotransmitter, it also affects serotonin in your brain, and that affects your mood. Um, then when we go on to sleep disorders, that's another one that can be very common. And it's specifically REM sleep behavior disorder. So that is something where people at night, usually during your REM stage of sleep, people are paralyzed. They don't move. But in this REM sleep behavior, they actually move and lash out. They might shout. They might, you know, accidentally hit their bed partner, you know, so that's stuff that can be very, you know, people don't kind of know where that comes from, but it is definitely can be connected with Parkinson's. And then there are some people, about 30% might experience some sort of cognitive impairment. And that really ranges from very mild, you know, word finding issues is the most common. I can't think of this word, you know, what is that? To all the way, there are some people that do develop dementia. Psychosis, sometimes people can hear things or see things. That's not, sometimes that can happen. And then sensory, kind of in the middle. Visual disturbances isn't as common, but sometimes people can have double vision. Loss of smell is very common. In fact, some of that people report loss of sense of smell way long before they have any motor symptoms of Parkinson's. So actually that depression, anxiety, and the sleep, those are the four, they call them dromal symptoms that could sometimes pop up 10, 20 years before the motor symptoms appear of Parkinson's. And then the right side is autonomic. So we have autonomic system that just, you know, deals with everything kind of automatically that we don't normally have to think about. And sometimes that can be affected with PD. So orthostatic hypotension is a prolonged drop in blood pressure. So we've all experienced, you know, if you get up fast, if you're laying down and you get up fast and you feel kind of woozy, that's that feeling of your blood pressure dropping very quickly. But with orthostatic hypotension, that blood pressure continues to stay low. And so that can cause people to feel a little woozy, dizzy, unsteady. And of course, then that is, people are at a fall risk and it's a safety issue. So something to think about. Constipation is extremely common. So people can have that. And actually, that probably should go with that pre-dromal symptoms that I said before, that could happen way long before. Urinary dysfunction and sexual dysfunction too can happen with some people. So I know it's a long list, but I like to make sure people kind of know what's connected with Parkinson's. And I did want to touch, you know, there are some things with advanced Parkinson's that can sometimes, you know, come up. And one of them, and not sometimes even advanced, some people have freezing of gait. So when they're walking along and their feet almost like get stuck to the floor, or they take small steps and shuffle forward. So that can sometimes happen with Parkinson's. The other thing is your voice, a soft voice, and sometimes trouble swallowing. So if you think about the motor, how things are becoming stiffer and slower, that can affect the speech and the swallowing. Those muscles can become stiffer and slower, which causes this. The good news is that I'm going to tell you in a minute that there are some things you can really help with therapy and exercise, and your voice and the swallowing is definitely one of those things that you can help with exercise and things. So we'll get in that in a second. And then, of course, balance issues can be sometimes trouble for people, especially going backwards. For whatever reason with Parkinson's, if people are in a small space and they start to step backwards or turn, that is sometimes can cause more falls in people with PD. So just very briefly, these stages, people talk about stages. They want to know, what, what's the progression? And I'll be honest with you, there's no prediction for people of what the progression will be. It really looks different from person to person. But in general, this is what your doctor kind of, when they do the tests in the office, these are the stages that they might do the test and then just kind of say, okay, they're in stage 2 or they're in stage 3. And so I just kind of point that out so that that's if the doctor uses that scale and that stage, this is why. But if you see the years above there, years from diagnosis, someone can be in stage 3 probably their whole time, or, it just really can vary. So it's not something to really get hung up on, but I think I like that people kind of know about what your doctor is kind of thinking about with the stages. Okay, we'll get into treatment. So what are the things that are going to help? And so the number one thing that has been the treatment all these years has been medication. And that is really what the neurologist or your movement disorder specialist is good with determining the medication, that starting you on a dose and getting you at the right dosage to help maintain, have good symptom management. So that really helps manage symptoms. It helps the most typically with stiffness, slowness, and some tremor sometimes, but other people do describe some of those non-motor symptoms that the medications can help too. Therapies is another huge thing to just keep in mind, that those therapies are out there for you. So physical therapy, occupational therapy, speech therapy. So if that's something that you need, we have lists of, we know the therapists that know Parkinson's. You can always call us, but definitely to reach out and get some sessions of therapy, to help with whatever you're kind of going through. And typically insurance will cover that if you have a Parkinson's diagnosis. I'll drop down to deep brain stimulation because that's kind of the next treatment. Deep brain stimulation has been around for quite a while, but basically what it is it's a pacemaker for your brain. So that picture, there's an electrode that they do a surgery, they put an electrode down deep into the brain where your dopamine is stored. And what they do is they turn on a little bit of an electronic impulse, which mimics dopamine. And so usually people who have this are able to get off of most of their medication for quite a while. Now, not everyone's a candidate for DBS. It's not a cure. It just helps treat the symptoms. So the people who are best candidates typically of deep brain stimulation are people who respond really well to the medication. And really the gold standard medication is the levodopa carbidopa, also called Sinemet. So if someone really responds well to that medication, they probably will respond well to deep brain stimulation. And also they don't want anyone doing deep brain stimulation if they have like a more cognitive and issues, because you do have to really take care of the equipment and things like that. And just kind of, there's more things there. So that's deep brain stimulation. And then the most exciting news we've had, just hot off the press, so the bottom left picture, this just got FDA approved last month, and it's been 4 years in the works with human trials trials, and we've been waiting for the FDA to approve it. But what this is it's a continuous medication pump. And it just goes, there's a little thing that goes slightly into your skin, and it provides a continuous dose of that carbidopa levodopa throughout the day for 24 hours and night for 24 hours. So this is really going to be a great option for people who might potentially really have a lot of off and on times. So with Parkinson's, you take your medication and maybe 30 minutes later, you feel good, you're on, you're moving around, and then there's a downtime where people feel off. And this type of treatment can really help lower those off times, so that people are a little bit more steady with their movement. So that's something that just came out and we're excited about. So the jury is still, Medicare and all the insurance coverage is still working things out. It's brand new. So something, that talk to your doctor about, but it's probably not being prescribed right this second, because insurance is working that out with coverage. Okay. I mentioned medication, and really the goal of medication is get the right dose, the right level where you're having some good symptom management, but you're not having, more major side effects. And so that can take a while, especially starting out, to find that dose if someone's first newly diagnosed. And then after so many years or as time goes on, that those need to be adjusted. Those medications need to be adjusted. So that's always something to work with your doctor about to get that right dose. I did mention the therapy, so definitely always, physical therapy is so important for walking, strength, balance, getting that exercise program together. Speech therapy. There are specific speech therapy programs for people with Parkinson's. This LSVT is one of them, and actually there's a second one that I need to add to this slide. So a lot of opportunity out there if you feel like you're having some trouble with your voice being softer, or even swallowing, they can help with that. And then occupational therapy is really great for any kind of fine motor things, trying to be more independent with your daily activities, also for a home safety evaluation and recommendations there. So know that these therapists are out there and available if you ever need it. Oh, you know what? I got ahead of myself. So I already explained the DBS. So I explained the DBS, so I'm going to skip over that. But let's go into now managing well. So those are the treatments, like from a medical perspective, that you would work with your doctor and your healthcare team and the therapist with. Now I want to get into what are the things that you can do to manage well. So there's many things, unfortunately, with Parkinson's that I'm sure you know that there is out of your control. But these are the things that there are some things in your control where you can have a better symptom management and better quality of life. And so these are the 5 things through the years that we have found. If you really focus on doing these things and managing these things well, that you can have like I said, manage the symptoms better, and people can have a better quality of life too. So I'm going to go into each one of these just briefly. Exercise. You probably heard it. It's the number one thing that you can do for Parkinson's to help. So many, many studies out there with exercise and Parkinson's. At the very least, it helps you manage your symptoms better. But there are a number of studies that have showed that actually it can slow the progression of Parkinson's down, which we don't have a pill for that yet. So actually exercise is extremely powerful tool for people with Parkinson's. So if you aren't already, just make some goals. And we talk about, you really want to think about having a mix of different types of exercises. So those 4 bullet points there at the end, that's when you want to think about. You want to have aerobic, so walking, biking, swimming, anything that's more aerobic, make sure you're having some of that. You want to have strengthening things where you're building muscle, building your strength in your body. Definitely stretching. I know that's something a lot of us forget about. But just daily stretching in the morning can be really important. And then balance. And that's another piece that we forget about too. And so you want to pick some type of exercise also that's challenging your balance. So that could be something like Tai Chi, dance, um, yoga, things like that. So something that's challenging your balance, very important to make sure that you're doing that every week. Just kind of hitting on those different things every week. Some people shoot for 4 days a week exercise for maybe 40 or 45 minutes or 30 minutes of exercise 5 days a week. That's really those are great goals to do. I do know a number of people that they feel so good when they exercise, they do it every day. So, it's really up to you, but if you can be exercising 4 days a week, that's really phenomenal. Nutrition, very important. So probably across the board for anyone, really the better you eat, the better you can feel. But specifically with Parkinson's, and oh yeah, I do have it listed. There's the Mediterranean diet is one if you're looking for something to kind of follow, and also something called the MIND diet, MIND. That's the latest kind of brain health diet that's out there that they think is potentially good for Parkinson's. So just in that, what that includes is vegetables, fruits, whole grains, very important. So Atkins diet, where you cut out carbohydrates, is not good for Parkinson's. You want to make sure you're having whole grains because actually the medication is actually works a little better if you do have whole grains. And then just some good sources of protein, beans, nuts, lean proteins, fish, chicken, and then some of the good fats like olive oil, avocados, things like that. So that's just some ideas of some things. Um, but I'm going to jump back up to the top of the slide. So protein, you might have heard about protein, that for some people, protein can decrease the absorption of your medication. So you do have to be careful with protein, taking that at the same time as your medication. So that's typically why the doctors will say, take the medication on an empty stomach, either 30 minutes before you eat, at least 30 minutes before you eat, or you wait 2 hours after you eat. So that's kind of why that recommendation's there, is really to avoid that protein. Now, I'll put a little asterisk on that. Not all people are affected negatively by the protein. So just something to keep in mind. You can, if you really want to pay attention when you're taking your medication, if you're real regular about it, and if you do have protein, at some time when you take your medication and you don't notice much of a difference, then you're one of those people that it doesn't affect. But it's just something you just want to pay attention to. And if it doesn't interact now negatively, it could potentially down the road start to cause trouble. So just something to remember about protein. Constipation, I mentioned, that's very common with people. So you want to drink plenty of fluids. Exercise is great with that. If those two things aren't helping with it, then the next step would be to talk with your doctor about, and foods, of course, helping with it. But then you can talk to your doctor about any kind of further things that might help it. But constipation is something important not to ignore, because when you're backed up in your GI tract, your medication is not going to be as effective because it goes through your GI tract too. And so it's not going to be absorbed in your body is good if you are constipated. So just something not to ignore. Okay. Number 3, so I'm kind of on those things, how to manage well, so we've got the exercise, we've got eating well, and now we've got your care team. And so the care team, something just to think about. This isn't something to dive into and do right away, but you just want to think about in general, building a good care team. So you want to get a doctor that understands Parkinson's well, and you want to know the therapist to go to if you need any OTPT speech. Um, and then, any other sort of people or specialist or support people that can be on your team. You may not need them all the time, but just people that you can call on if need be. And I put APDA there because I hope that you see us as part of that support system. So we offer, and I'll go through in a second, a lot of different resources for people. They're all free. And so we hope that we're also part of your team on that. Okay, number 4, medication schedule. So you might have heard that the medications are really important to stay on time. And so Parkinson medication is very reactive. So once you take it, it starts working pretty soon in about 30 minutes. But then it also, at the same time, then it also goes out of your system too. So it doesn't stay in your system. So that's why it's important to make sure you have a routine. Either sometimes people have 3 doses a day, 4 doses a day. Sometimes people have 5 doses a day. But it's really important to stay on a routine so that you can, make sure that you're keeping those symptoms at bay. And if something changes, well, gosh, it's not because your medications, it might be something else to talk to your doctor about. And as time goes on, time becomes more important too. So sometimes when people are first diagnosed, they'll miss doses here and there. They'll be kind of a little, loose with their medication schedule, and it's not a big deal. But it does become more of a big deal as time goes on. And so it's good to just get in those habits right away to stay in a good routine. And then the 5th one, which can't be underestimated, is really getting the support that you need to manage well. So number 1 is if you have depression and anxiety, make sure you treat it. That is not something that people should suffer with. The way that Parkinson's, depression's, anxiety is treated is the same way it is in other people. So there might be a medication or two that isn't as great with Parkinson's than other people, but for the most part, that can be treated. And so that is definitely something you want to make sure you treat because you want to make sure you're feeling motivated and good to exercise and participate in things. So definitely, not to isolate yourself, stay active, keep doing the things that you enjoy. See friends, do things, get educated, stay informed. Of course, you're here with this presentation, so that's wonderful that you're just staying in touch and being educated. And then of course support groups are really important. Well, I should say counseling and one-on-one counseling, always a good idea for people, and also spouses or family members, but then also support groups are so important to get connected with a support group. And that's where APDA comes in. We have a lot of different support groups that you could attend, and I'll go over that in a second. But always making sure, this piece is so important to maintain all that. Okay, so now I'm going to kind of go into, that was the overview with Parkinson's, and I want to go into make sure that you know the resources that we have, so that if you need anything, just reach out and we can help with that. But this is our mission. We really want to provide the support, education, and research to help everyone impacted by PD live life to the fullest. So that's not only just the person living with Parkinson's, but also their spouse or their care partner and their family and friends. So some things that we can offer, we have a lot of information about Parkinson's. So you can call us, you can email us, we can send you a packet of information. So, always reach out if you have questions or want more information about something. Another thing we have is we have a quarterly newsletter. A lot of people like to receive that. You can get it mailed or emailed. And so that gives different articles. And then also in the middle, it has a list of all of our latest support groups and exercise classes in the community so that you kind of know which ones are out there. And speaking of exercise and support groups, so right now we have over 60 exercise classes each week in the community in our network. They are all free, provided free of charge. And we also have virtual exercise classes. So if either you're further away from one of the classes, or you just can't get out in general, or it's bad weather and it's cold like now, and you just don't feel like getting out, but you still want to exercise, we have live Zoom classes that you can do. And we also have a YouTube page with a ton of exercise videos that we record each week that you can just pull up and follow along with. We have our support groups, over 30 in our network too. And it's the same with exercise. We have them both in person and virtual. And so we want to make sure people can kind of plug in where they want. We have our traditional support groups, but also ones that are for caregivers only. We have ones for the adult children. If you have, a child, that's an adult, we have a support group for them. So we try to provide a bunch of different types of support groups, and then also in different locations that people can plug into. I mentioned the YouTube page. Here's a screenshot of it. It's called if you just say APDA Missouri, if you go to YouTube and type that in, it'll pop up. And we have a lot of different playlists. We have seated exercise. We have so we have levels 1, 2, and 3 is kind of how we think about it. And so there's all different types of intensities that you can look at. And then there's also Tai Chi on there. So just different things. It's something to check out. Of course, we're always available for referrals. If you are looking for someone, something related to Parkinson's, some sort of provider, you can always give us a call and see if we have a list of some potential providers. We also provide small group wellness programs throughout the year. One of them is this press program. It's an 8-week program where people dig much deeper into different topics, and it's a small group. We limit it to about 12 people. So the people get to know each other well, and then they also learn a lot. So that usually we offer that twice a year. We have Treble Clefs, which is a singing group, a wonderful singing group that people love. We have a fall prevention program. We have a caregiver program coming up. So lots of different things that you can dig into. And by the way, that caregiver program is specifically for caregivers only, and it is an 8-week thing, like I mentioned, like the presses, but it's for caregivers. And then just so you know about, we have a lot of virtual resources. There's a lot out there, but I love our APDA resource library. You can go on it. You can type in your topic that you're looking for. If you want a webinar, if you want more just an article, and it'll pull up everything that we have in our database, and you can kind of check out those things. So something to take a look at. Our Chief Medical Officer, Dr. Rebecca Gilbert, is wonderful. If you've seen any of her webinars, she is just a wealth of information. She has a blog too. So just a great resource for you. Actually, that's her on the left. Then we also have educational programs throughout the year. So we have one big conference every year in April. And that's you typically about 500 to 600 folks show up, and it's a half day with some professionals and leaders in their field that speak on different things. So that's definitely worth checking out. And then throughout the year, we have Parkinson education programs where we'll have a topic and one speaker, one topic. And so you can kind of plug in there where you'd like. And then how do we pay for all this? Everything's free, but we do have a Top Golf event in May. That's a lot of fun. It's one of our fundraisers. And then we have our Optimism Walk. That's in the fall, usually every October. And that is a ton of fun. It raises awareness, of course, raises funds so that we can provide these things for this area. So it just happened, unfortunately, but look for that if you'd like to, join in next year. That would be great. So this is our phone number and our website. The website, I put it in the chat. But please don't hesitate to reach out to us, and if we can't find the answer, we'll try to get someone that can. But I just want to I'll end the presentation there, and then we can open it up to questions. I'm happy to try to answer any questions that you have. Field, but okay. Please reach out to us. Our office is in Chesterfield, but we really, we have things all over the place. So, just give us a call, and happy to share further. So thank you. I'm glad that you found it helpful, and I appreciate you having me tonight.
Thank you so much, St. Elizabeth's. Really appreciate your time and effort and your knowledge to really help our caregivers and and our families to cope and understand and what resources there are out there for us. So thank you so much for your time tonight, Amanda.
Absolutely. Thank you guys. Take care.
All right, you all have a good night. Thank you.
Bye.
Bye.